I was actually from a one-parent household, and we moved around a lot, probably about 11 times by the time I was 10. So for me, it was constantly new environments, constantly having to adjust to new things. Eventually went into a music program, found that's where I could make friends fairly easily. We went into marching band, pep band, jazz band. That carried forward to college and being part of a traveling music program, actually here in the Boston area, and that allowed me to see more of the U.S. I grew up in a very traditional household, though. My mother would have us with my grandparents, and I have the Italian grandmother, so tradition was very important. My mom was one of 9. We would have our set chores every night after dinner that everybody had to do to keep things picked up, ready to go. And I grew in that traditional household, but always tried to find, what's my niche? How can I fit? And that's where the music aspect came into play. It was, what did we need at that time to really make this group effort work? And Lil Brass was something that they needed at that time, and so I said, okay, let's see what we can do, and gave it a try. I am a learner by trait. I constantly want to try something new. I am constantly willing to see what is that next challenge. How do we fit the pieces of the puzzle? With that, I have to be very collaborative, and I find that as a big, important skill for me in working with our different investigators. You never know what the research community is going to throw at you next. You never know where the regulation's going to go. You never know where the research funding is going to be coming from and the requirements on that, or even just where our health system itself is going to be pursuing its new avenue, its strategic plan. And so the research tends to flux with all of that, and to be collaborative and have that let's try something new approach, let me be a learner, let me absorb this, let me take this in, I think is key to what I do. I find that the traditional approach is still valid in many ways. It's not something that we've, just because we've come a little bit farther, that we've been able to say, you know what, that's not important anymore. We still have very key elements. Belmont still rings loud and true. The respect for persons is something that, as people are trying to take a little more control in what's happening in their lives and what they're responsible for, the respect for persons, I think the autonomy issue really comes to the forefront still. When we're looking at the different challenges that we're now facing, it's how do we find a way to make that autonomy, that respect for persons, even the justice in appropriate selections, all of that still comes into play, but it's a manner of how does that look now? We talk about the different financial inequities, we talk about the different cohorts of people that we have living in our communities. How has that changed in the last 40 years? Working in Springfield, Massachusetts right now, we're talking about the new casinos and so forth coming in. What does that look like for research, and how do we still apply the elements? It's not going to be the same application as it was, because it has a new identity to it. It's a different group of people you're trying to get that message across to. It's a different perspective that they have. In our community, it's unfortunately one of the poor communities in the nation. We're dealing with a growth in our homicide rates. We're dealing with a growth in drug addiction. That's been a really big issue for us the last couple of years. And yet, with the changes in healthcare and the funding of healthcare, we're not finding that we have the facilities to really take care of that, or the expertise to take care of that. So we're having to look outside and find ways to build those teams to now address that. And now it's a whole nother group of people to educate and bring on board with what does the ethics look like? How do we build that forward to address the new struggles, to address the new challenges, and how does it get applied? So the foundations, I think, are still applicable, but the application of them is very different. I really had to understand the basics of where the regulation was coming from, where our researchers were coming from. I started off at a research center here in Boston under a former general clinical research center funded by NIH. We were heavily invested in HIV research, having people from the community who were coming into the clinic. Sometimes that was their only medical care. They didn't have insurance to cover outside care, and we were running nutrition programs, drug programs, so on and so forth, to create a collaborative approach to their care. And seeing the intricacies of how that worked, how the nurses had to interact, the type of documentation that they were trying to accommodate, yet still trying to be sure that they're doing that one-on-one with the patient, you know, that is where I got to find a little bit of my niche. You know, I could help with that paperwork. I could help with that documentation. I could make sure that the reg binder was put together in an appropriate manner. They needed a witness for consent. Well, if it was a study I wasn't listed on or involved in, I could serve as that witness. You know, it was that bare basics of how does this structure work that allowed me to then say, okay, what else can I do to assist with that? How can I bring that a little bit farther? And the interaction with the patients that were coming into the clinic, who were also research subjects, that interaction really gives you that feeling of how important is this to them, and how much does it need to be simplified for them to understand or be able to get through that process. They don't want me handing them 50 pages of documentation when they walk in, but is there something that they do need? Sometimes it was simply they needed a brochure translated, you know, to really have that aspect and know they had somebody else call the interpreter to come up to the visit because somebody had missed that, but it was an important key part to making that subject feel comfortable and making the investigator feel comfortable. And so taking on those additional tasks really helped me move forward in my understanding of how the research was operating, how it functioned. So when I, for family reasons, needed to make a move out to Western Massachusetts, there was the IRB position, a low-level IRB position that was available. And I said, you know what, this is a different application, but it would still be something that I can do to help our investigators. So it was a different application that I was still able to say, I'm going to help our research subjects. I want to make sure that whatever we're putting forward is something that has the possibility of being understood by them, but will also let me be that collaborative partner for some of the researchers themselves. You know, what do we do to get this through an approval process, but still make sure that everybody's protected along the way with, do they have the appropriate information? Is this feasible? Is it being done in a manner that's going to make sense, that can be carried on after the research is done? You know, what were the dynamics of all of that? And for me, that was an important piece, and having to understand a little bit more, really come into my own with what does the regulation really mean, how does it get applied, and find ways to help our subjects present things in a different manner, using that experience back at the clinic, but also kind of serve as that go-between, the interpreter, between our subject population and an investigator trying to navigate everything. What we've had to do at our institution, what we've chosen to do at our institution, is really take that subject interaction and use it as a training tool. So we've gone as far as to have subject participant panels come in and do noontime lectures. This was my understanding of being in a research project, or a couple of them, I didn't know I was in a research project. You know, that's a big gap. That's a big barrier. Well, what could have been done differently? How could we learn from that? Doing those panels, having them involved, is really that eye-opening experience in some ways for our investigators and our research community at large. Having them, the subjects, involved in our consent training process. A couple of subjects or a couple of volunteers from our community every year come in, and we have our new investigators practice, how do I conduct consent, and give me feedback on that process. That is not something I can say we see done everywhere, but that's an approach we've decided to take with some of the barriers we have with our community in language or economics. And that training tool has been a significant help for us, especially with some of the newer people, my staff included. It's also giving a voice to that research community and the research subjects in our community, in that they're able to be involved in the process. It's not just, let me be that patient that is serving as your guinea pig, trying to see, will this work, will it not work? They're also going to be a part of that process. I'm helping train. I'm helping learn more about this. I'm helping to facilitate your learning and moving this research forward and making it better for the next person. We have a noontime lecture series that we try to do at least 5 to 6 times a year with our research community. Part of that is so that our coordinators and others can earn credits to keep up certifications, because we require that our research staff be certified, SOCRA certified, or another certification, ACRP, Primer, the CIP certifications. We try to make sure that we're building a little bit of an educational program that will help assist with that. And we were looking at our numbers and things and trying to see, okay, how are we doing? What subjects are of interest to our research population? And that's where we kind of came to, we need something different. We need something that's going to reach out, try to bring in more of a crowd. What's something we haven't done before? And so I have 2 education and compliance coordinators under our Human Research Protection Program who put their heads together, and we kind of said, okay, what can we do? So I have to give Judy Pride, one of our integrity coordinators, really a big component of that. She said, well, what if we do something like this? And this is where we started to build this. And so we reached out to our patient advisory panel, the person who leads that, and tried to see what we could do to build this. We reached out to different researchers as well and said, do you have a subject who would be interested in talking to us a little bit, giving us their experience? The response from our investigators has been very positive. It's been rated as one of our highest programs that they've wanted to take an interest in and be present for. Let's face it, they're all very, very busy. With all of the changes, there's a big push from the hospitals to make sure they're meeting their requirements for seeing the patients, and there's a big push from our community to be sure they're getting in a timely manner. So for them to take such an interest and want to make sure they've got the time available, really sent forth the message to us. This was something that was important to them too, and that's why we really wanted to move this forward. So it's been beneficial to all parties. You know, we're not perfect. We're not doing everything as the best possible manner that we could, is what we're learning from this, but we're taking that and trying to build upon it to make it something even better. There are so many different things that we're tasked with every day that I have to step back and remember that everybody's trying to reach an end goal of a better result. Everybody is out there trying to do the best that they can. They have a mission, they have a goal, they want to meet that goal. Facilitation, trying to be that person in between who's able to weed through the regulation and the hospital policy and help them reach that goal, but also with our subjects, be that person who's able to take their call, explain something if they're confused by it or they want some additional information on what could be happening with their study, they received a notification in the mail, but sometimes they misplaced their contact information for their research coordinator. Being that facilitator to help open that communication is probably one of the most important things I can do. The greatest obstacle in trying to do that job is to remain positive without getting stuck in the constant change. Remembering to think outside the box and find ways to apply the regulation appropriately or help move the study in a different manner, move the protocol writing in a different manner to fit better with the regulation. The regulation isn't one size fits all, and the protocol is never written as a one size fits all. So it's fitting those pieces of the puzzle. When I think about who should be approached, who should be recruited to really come into this field, to look at research administration and the protection programs that we're now building, it has to be a person who's willing to be a learner, constantly be willing to try and learn something new, because it's how do you apply it. They also have to be very flexible. The regulation is looking at possibly being changed. The guidance that comes out sometimes changes in interpretation. The approaches that are acceptable or expected by some of our research subjects, that all changes. We look at social media now as a different recruitment method. We look at, or even as a method to carry out a project, we look at challenges with changes in government and leadership. It has to be somebody who's going to be flexible. It has to be somebody who's willing to be a learner in order to be successful.